my name is Trina Altman, and I'm an ERYT, that's an experienced registered yoga teacher. I'm also an integrated yoga tune-up teacher and a yoga therapist. And I teach regular weekly classes, privates, and workshops here in Los Angeles, and I also present nationally at yoga and fitness conferences. I'm here to talk to you about your breath. And there's 3 abodes of breathing. So there's abdominal breathing, thoracic breathing, and clavicular breathing. And we have the primary muscle of respiration, which is your diaphragm. And your diaphragm attaches to your ribs all the way around. It's like a mushroom. It's circular. It goes all the way around. If you think of your bra strap going all the way around. And when you breathe, you want your diaphragm to move. So when you inhale, the diaphragm contracts and it moves down. And it pushes the abdominal contents out, which gives the appearance of your belly swelling. When you exhale, the diaphragm relaxes and it moves up, and it pulls the abdominal contents up with it, which gives the appearance of your belly falling or sinking. So it's not that you're forcing your belly in and out, it's the movement of your diaphragm that creates abdominal breath. And abdominal breathing is the most relaxing way to breathe. Thoracic breathing, you can isolate and just breathe in the thoracic region by bracing your abdomen, which would stabilize your spine, and just moving through the ribs. This is exciting to the nervous system, upregulating, but it has its purpose for when you need to pick up heavy objects or stabilize your spine. And then there's clavicular breathing, which is a very stressful way to breathe. It's the type of breath that a smoker would do, sucking in the very last drag, or somebody at the end of a marathon heaving at the very end of the race. So it's all up in the top area. And many of us live in that area. It's not that exaggerated, it's more subtle, but we're in the sympathetic nervous system, or fight or flight. The belly isn't moving, the ribs aren't moving, and the muscles in the neck and shoulders are contracting. And since we breathe around 20,000 times a day, that's a lot of contracting. So I'm going to teach you a simple way to practice abdominal breath. So clavicular breathing, meaning breathing in the clavicular region, your collarbones, and cervical breathing, the vertebra of your neck spine, are synonyms. They mean the same thing. So I see a lot of clients, students, and Dr. Tamura sees a lot of patients who repetitively exhibit clavicular or cervical breathing. And the reason why this creates so much neck pain is because the muscles, the sternocleidomastoid, the scalenes, the levator scapula, are contracting continuously all day long, and they're getting tighter and tighter. And this creates pain and tension and also headaches, and can lead to clenching of the jaw, grinding of the teeth, and basically the TMJ and the neck pain go hand in hand. So if we can change the way you breathe so that you are no longer clavicularly or cervically breathing, you will significantly reduce the tension in your neck and shoulders, and thus pain in your neck, shoulders, and jaw. So what you want to do is come down onto the floor, lie on your back in what's called a constructive rest position, which simply means your knees are bent and your feet are on the floor. And then take your thumbs and find your ribs. So again, we'll refer as a landmark to your bra strap or bro strap. You're going to press in between the ribs on the intercostals, gently down and then towards your feet. And then begin to breathe in the belly region. So as you inhale, let the belly swell. And as you exhale, allow it to deflate. And you can test it by taking a yoga brick or just any light object, place it on your belly. And I find that closing the eyes helps downregulate the nervous system. So I'll begin some abdominal breathing. So my ribs are still, and as I inhale, the diaphragm moves down, presses my belly out, the block up, and as I exhale, the diaphragm moves up, and the block moves down. Once you feel like you have it, you can relax your arms on the floor and continue with this breath. Inhaling, swelling the belly, and exhaling, allowing it to deflate. And you can even create a mantra where each time you inhale, you think of the word soft, and each time you exhale, you think of the word belly. You inhale the word soft, and exhale the word belly. So practice this at home and tell us how it goes for you. Feel free to contact me at my website to schedule privates or to contact Dr. Tamura to set up an appointment to help with the combination of TMJ and breathing patterns. Hi, my name is Trina Altman, and I'm here to talk to you more about breathing. In the first video, we talked about abdominal breathing and how there are 3 abodes of breath. There's abdominal breathing, thoracic breathing, which is the rib cage, and clavicular or cervical breathing. And in the first video, I demonstrated how to do abdominal breathing. So just this part of your body is moving as you breathe. And that's the most relaxing way to breathe. This video, we're going to do a combination of abdominal and thoracic breathing. And when you combine the two, it's a little more energizing. You don't ever want to do what's called cervical or clavicular breathing. That is going to tense up all the muscles in your neck and shoulders and create neck pain and also increase symptoms of TMJ. But for abdominal thoracic breathing, it's a 2-part inhalation followed by an exhalation. And this breath is very useful when you're seated and when you're standing. So there is a muscle called the transversus abdominal muscle. And it's one of the deepest muscles in your abdominal muscles in your body, and it wraps around on the sides. And it's extremely useful for stabilizing your spine. That muscle can be engaged when you're employing abdominal thoracic breathing, which is very important if you're going to bend over and pick up a heavy object, or you just need to support your weight against gravity sitting in a chair all day or standing in line at the Starbucks. You want your transversus to be engaged. It isn't engaged when you're doing abdominal breathing. Abdominal breathing, again, is the most relaxing way to breathe, and it's a great way to breathe when you're lying on your back. So I'm going to lie on my back in the constructive rest position and teach you how to do abdominal thoracic breath. So as you inhale, your belly swells, and then you carry that breath up into your ribs, and then you exhale. So I'm going to take the block again and place it on my belly. I'll inhale, and the belly swells, and the block rises. And then I carry that breath up into my ribs, fill the lungs, and then breathe out. I'll do that one more time with the block up a little higher. And you can watch the belly swell as I inhale. And then the ribs expand. Everything stays quiet around the neck and shoulders. And then I exhale. And then you begin again. The gut grows and expands. The ribs stretch apart circumferentially, like an inner tube inflating. The neck and shoulders stay quiet, and then you passively empty the breath out of your nostrils. We'll begin again like a wave in the ocean. The breath travels from the tailbone to your navel, from the navel to the solar plexus. The neck and shoulders stay quiet and relaxed, and then the breath exits your body, and you feel the body get heavier into the floor. So I hope you'll practice abdominal thoracic breathing at home. Try it lying down on your back first. It's the most relaxing way to learn the technique. And then you'll be able to utilize it and employ this breathing practice in a sitting position or standing position. And if you need help with TMJ, you're having neck pain or jaw clenching or teeth grinding, contact Dr. Tamura. And if you'd like to learn more about different breathing techniques and ways to downregulate your nervous system and reduce tension in the neck and shoulder muscles, you can contact me by going to my website. Thank you.